Dsaek's stripping automated endothelial keratoplasty is the new surgical technique for the treatment of posterior corneal dystrophies, which enables a surgeon to replace diseased endothelium with healthy donor endothelium. Preparing the donor cornea when performing Dsaek requires the use of Moria artificial anterior chamber system with one of our two chamber cover options, the chamber cover with integrated CBM guide ring or the chamber cover with adjustable CBM guide ring, and the Moria CBM microkeratome 300 or 350 micron head. To mount the CBM blade into the head, open the blister pack and carefully remove the blade. The cutting edge of the blade should be inspected with the blade edge being perfectly uniform before and after its insertion into the CBM head. Insert the blade in the head, being very careful to avoid any contact between the metal of the head and the cutting edge. The blade should slide easily to reach its final position. If you feel any kind of resistance, check the blade opening in the head. If the opening is not obstructed, and there's still resistance inserting the blade, change to a new blade. Before screwing the CBM head onto the turbine, check that the plastic blade holder is correctly centered in the head and that the blade engages the turbine motor shaft. With your fingers, screw the turbine clockwise onto the CBM head, holding the head and the turbine as shown to prevent the blade from falling. The head should be securely finger-tightened only. Fix one end of the turbine flexible hose to Moria Evolution 2 or 3 control unit, and attach the other end to the turbine by tightening in a clockwise direction. Lubricate the CBM head with BSS in the blade hole and on the front plate and check the blade oscillation again. Depress once the vacuum foot pedal. Then depress and release the forward advance foot pedal to visually check that the blade is oscillating in the head. Release the vacuum by again depressing the vacuum foot pedal. Open the blister pack of the Hanna treffing blade. Carefully pick up the Hanna blade with a Moria needle holder. Do not touch the blade edge. Carefully hold one of the three handles of the blade and insert it on the Hanna punch as shown. Then lock the blade by turning the mechanism clockwise. Connect the irrigation set previously filled with the side lure lock of the artificial anterior chamber. Turn the irrigation stopcock to open the irrigation set. Retract and lower the piston of the chamber as much as possible by turning the chamber screw counterclockwise. Irrigate until the fluid gently runs out of the chamber. With Moria Troutman forceps, take a donor cornea with at least 16 mm scleral rim in all directions. It is important to coat the endothelial side of the donor cornea with viscoelastic. The use of Viscoat or any other viscodispersive agents should be avoided. Place the donor cornea on the chamber piston with a 45-degree angle to prevent an air bubble formation. Center the donor cornea onto the piston. The horizontal diameter of the cornea should be parallel to the table border between you and the ALTK. Then, take the chamber cover and place it on top of the ALTK chamber piston. Close it by turning it from its unlock to its lock position. Raise the chamber piston as much as possible by turning the chamber piston screw clockwise to seal the corneal tissue with the chamber. Pressurize the cornea with the syringe until firm, and then lock the stopcock by turning it 90 degrees to the irrigation line. Check the seal with a Moria dry microsponge. There should be no leakage between the donor cornea and the chamber cover. If you're using the chamber cover with the adjustable CBM guide ring, firmly holding the chamber cover with one hand, lower its micrometric screw with the other hand as much as possible by turning it clockwise to obtain the largest diameter resection possible. Place a 6/8-10 mm applanation lens on the cornea to check that the resection diameter will be optimal. place a tonometer on the donor cornea to check the IOP. We recommend the use of an ultrasonic pachymeter to check the corneal thickness. With a Moria Clean Spear microsponge, remove the epithelium from the donor cornea. If the CBM guide ring is not already a part of your ALTK chamber cover, place the independent CBM guide ring on top of the donor cornea and fix it with its screw. Lubricate the donor cornea and the post of the CBM guide ring. Place the CBM turbine head assembly onto the guide ring. Activate the vacuum by depressing once the vacuum foot pedal. Then depress the forward advance foot pedal and rotate the CBM microkeratome 4 to 5 seconds, making sure to make a complete pass with one hand while firmly holding the chamber cover with the other with a slight clockwise pressure. Once the resection is completed, release the forward advance foot pedal and release the vacuum by depressing once the vacuum foot pedal. Lift the CBM turbine head assembly off the guide ring and remove the created anterior lamellar cap from the CBM head with Craft Moria forceps. Unscrew and remove the CBM guide ring from the chamber cover. Mark the center of the artificial pupil with gentian violet. Open the stopcock of the irrigation set again and start irrigating. Put the chamber cover in its unlocked position. Remove it from the artificial chamber while irrigating through the piston so that the posterior portion of the donor cornea stays in the chamber cover. With Moria Troutman forceps, transfer that portion to the Hanna punch block, endothelial side up. Be careful to center the pupil mark of the donor cornea on the center of the punch. Place conservative fluid onto the donor cornea. Create vacuum to hold the posterior part of the donor cornea in a well-centered position. Screw the guide cylinder onto the Hanna punch block. Engage the punch with its pre-inserted blade into the guide cylinder and push it down as much as possible with both hands. When at the lowest level, slightly turn it clockwise. Remove the punch from the guide cylinder while holding the Teflon base, and then unscrew the guide cylinder and take it away. Release the vacuum. Discard the scleral part of the posterior part of the donor cornea and put conservative fluid on the remaining corneal tissue. Congratulations! You have just successfully completed the first step of Dsaek, preparing the donor cornea. Moria has designed a Dsaek instrument set. To expose the patient's cornea, you'll first need Moria Shapira speculum. You'll also need Moria chamber maintainer to deepen the patient's anterior chamber. You'll then mark the recipient cornea with the Moria marker. And you'll outline the area of planned decimates and endothelium removal with the Moria Dsaek price hook. Thanks to Moria Dsaek strippers, you'll remove the outlined decimates membrane and endothelium. Moria Dsaek Guzzi forceps will allow you to insert the donor lamella as a taco into the anterior chamber.